Hello, my name is David Hazimi, and I'm here to talk about hiatal hernia. Hiatal hernia is a type of diaphragmatic hernia with protrusion or herniation of the upper part of the stomach through the diaphragm and into the thorax. In sliding hiatal hernia, which is type 1 and is the most common, the proximal portion of the stomach moves into the thoracic cavity through the esophageal hiatus, an opening in the diaphragm for the esophagus and vagus nerves. A congenitally short esophagus, fibrosis, or excessive vagal nerve stimulation, or weakness of the diaphragmatic muscles at the gastroesophageal junction contributes to the hernia. Gastroesophageal reflux is associated with this type of herniation. Coughing, bending, tight clothing, ascites, obesity, and pregnancy accentuate the hernia. Paraesophageal hiatal hernia, which is the type 2, is the herniation of the greater curvature of the stomach through a secondary opening in the diaphragm alongside the esophagus. The position of a portion of the stomach above the diaphragm causes congestion of mucosal blood flow, leading to gastritis and ulcer formation. Strangulation of the hernia is a major complication. It can present with vomiting and epigastric and retrosternal epigastric pain and is a surgical emergency. Mixed hiatal hernia, which is type 3, is less common and is a combination of sliding and paraesophageal hiatal hernias. It tends to occur in conjunction with several other diseases, including reflux, esophagitis. Hiatal hernias are common condition typically associated with dysphagia and esophageal reflux. Some reports estimate the condition to occur in 10 to 80% of the general population. Other reports differ, but symptomatic incidence increases with advanced age. In the general population, the incidence is approximately 0.5% and over 60% in the elderly. Conditions such as obesity and pregnancy increases intra-abdominal pressure and therefore can exacerbate this condition. Of all types of hiatal hernias, sliding represents approximately 85 to 95% of cases, whereas paraesophageal hernias represents 5% to 15%. Diagnosis is usually achieved via several modalities, including imaging, like barium swallow, manometry, which is with or without pH monitoring, and endoscopy. The typical treatment for mild cases includes medical management focusing on decreasing gastric acid production. More severe cases are treated with surgical correction. Nissen fundoplication, which wraps the gastric fundus around the lower esophageal sphincter, is a commonly used surgical remedy. With non-hiatal hernia reflex, The procedure strengthens the lower esophageal sphincter with a sliding hiatal hernia. However, the resultant increased size in the esophagus prevents the stomach from being pulled into the chest. According to our book, treatment for sliding hiatal hernia is usually conservative. The individual can diminish reflux by eating small, frequent meals and avoiding the recumbent position after eating. Abdominal supports and tight clothing should be avoided, and weight control is recommended for obese individuals. Antacids alleviate reflux esophagitis. Individuals who are uncomfortable at night benefit from sleeping with the head of the bed elevated 6 inches. And this is my reference page. Thank you for listening to me. God bless.